Alright, here we're going to look at meningitis, and this is going to be found in chapter 17. And we'll look at what is meningitis. And this is a very unfortunate, a very problematic disease. But the issue is that there are a lot of different organisms that can cause it. And each organism has its own virulence factors, different populations that are at risk, and some specific characteristics. So we're going to look at 6 specific types of meningitis, and then with one of them you can have petechia. So I want you to know what petechia is, and then also understand viral meningitis according to the lecture notes here. So meningitis in and of itself is just simply an inflammation of the meninges. So really it is an anatomical syndrome where many different microorganisms can cause an infection in the meninges and all cause the same constellation of symptoms. So some of the symptoms are very similar to each other, and it's difficult in immediately being able to identify what the causative agent is. It is important to be able to identify that causative agent, as treatment options may vary depending on the organism. So generally, the most serious forms of acute meningitis, those that come on quickly, are going to be caused by bacteria. And usually the way that the organism makes its way to the central nervous system is through a previous infection with in the nasal cavity, whether it is a sinus infection, maybe an ear infection, but probably sinus infection, and even potentially pneumonia. So with meningitis, typical symptoms regardless of the cause are going to be headache. The headache can be quite severe, painful or very, very stiff neck. Fever is generally going to be high. There can be nausea and vomiting. And because this is affecting the brain, there can also be photophobia, sensitivity to light. And then depending on the specific type of meningitis, there could be skin rashes that are present. And also then typical of a symptom that a sign that a physician would identify or request to be identified would be increased number of lymphocytes in the cerebral spinal fluid. So then moving on to the different types of meningitis, you have that caused by Neisseria meningitidis. And this is often called meningococcal disease. And this is caused by the gram-negative Diplococcus. And it's often associated with the epidemic forms of meningitis. And this is typically going to be on college campuses. That's one of the major places where it's seen. Excuse me. And this is going to cause the most serious type of meningitis. And unfortunately, with Neisseria meningitidis, a person can go to bed thinking that they just are very sick, that maybe they have a severe case of influenza, and actually never wake up again. So this is one of the types of meningitis that a rash is seen, and this is where you would see petechia. And because of the damage that's going on from the presence of the microorganism, there is damage that is done to the blood vessels. And this is caused through cytokine release, and so you have vascular collapse, hemorrhaging, and those two, the combination of those two processes produce petechia. And it's going to be very bright bruising, looking more like a blood blister versus just a plain old bruise. Alright, so here is just looking at how the organism can move from the sinus cavity or even the back of the throat. That this would be an initial infection, and then the organism is actually able to make its way through the bone protection, the layer of bone protecting the brain and cause issues there. Alright, then Streptococcus pneumoniae. Alright, this also causes pneumonia, but this is a gram-positive cocci that is generally seen in pairs, although it is strep, so strep would indicate chains. And so when you see chains, it's just the pairs lined up next to each other. Streptococcus pneumoniae is often a normal flora of the nasopharynx and major cause of bacterial pneumonia. This is actually the most common cause of community-acquired meningitis. So even though it's not necessarily the most severe, it is the most common. And the reason for that is just because it causes pneumonia. And so it's easy for an individual who has pneumonia to have high numbers of this organism, and then it moving, just because of its vast numbers, the sheer numbers of Streptococcus pneumoniae, it's able to make its way into the brain. And generally 25% of the patients with pneumococcal meningitis have pneumonia. Alright, the virulence factors for Streptococcus pneumoniae is its polysaccharide capsule. Alright, nearly all strep organisms have a capsule. It also produces an alpha hemolysin, so it's going to be cultivated on a blood agar plate. It's able to produce hydrogen peroxide that damages the central nervous system. It's able to induce brain cell apoptosis, making the disease process that much worse. And it's able to simply penetrate the respiratory mucosa and gain entrance into the bloodstream and then enter the meninges. Haemophilus influenza can be severe, alright, and it was the most severe cause of death by meningitis and the most common cause of meningitis prior to a very effective vaccine that was fully established in 1988. So right now, this type of meningitis is not nearly as common in the U.S. because of the vaccine. Alright, then Listeria monocytogenes. This organism is generally a foodborne pathogen. And in adults that are healthy, immunocompetent, this infection is generally very mild or subclinical, and so you have specific, non-specific symptoms like fever, diarrhea, sore throat, those type of symptoms that would be seen in a foodborne illness. And you may never see any meningitis-like activity. However, in the elderly, the immunocompromised, or fetuses, and even neonates, this organism can go to the brain and affect the brain and the meninges, causing a lot of problems, including septicemia. And unfortunately, with this type of meningitis, the death rate is about 20%. Now, pregnant women are especially susceptible to problems with this organism, not because it makes them sick. Right? Pregnant women could really easily be a healthy adult who she would have the mild or subclinical infections. However, the organism Listeria monocytogenes can cross the placenta and cause major issues in that developing child. And if it is very early in the, it really doesn't matter where or at what point in development of, or at what point in pregnancy that she contracts this. It could have very devastating results on that developing child, whether it be premature birth, basically premature abortion, because that infant, the devastation is just extreme, and then obviously then death. And again, not a health issue for the mom, but definitely a health issue for that infant. And then if, there's also the rare chance that it could be transferred postnatally through the birth canal through a normal vaginal birth. So the Listeria monocytogenes is a coccobacillus, and it has flagella on it, 1 to 4 flagella. And the reason this is important is because it's able to grow inside of host cells and move directly from an infected host cell to an adjacent healthy host cell. And it's able to do that by forcing its way along through the use of its flagella. Alright, so then here with the Listeria monocytogenes, how do you protect yourself? You just try to avoid food that might be problematic. And so during pregnancy, it's often advised that you don't eat soft cheeses and certain deli meats, right? Why? Because this organism is resistant to almost everything, right? The cold, the heat, the salt, the pH extremes. And so heating something doesn't necessarily get rid of the organism. And soft cheeses aren't always heated well or heated high. And so they could actually be harboring more organisms than, say, just your normal cheddar cheese that is pretty firm. Alright, Cryptococcus neoformans is a fungal organism, and it is going to be a major issue with AIDS patients. Alright, sometimes, very rarely will this cause an infection in an immunocompetent individual, but it will often cause what's called a chronic form of meningitis for immunocompetent individuals, and so it arises very gradually. But with AIDS patient, the onset can be very quick, and it's just like acute meningitis that you would see with bacterial infection. All right, headache is the most common symptom. Can be nauseous, neck stiffness, but this organism is fungal in nature and problematic in AIDS patients. Then with viruses, viruses can cause meningitis, and this is called aseptic meningitis. Why? Because if the cerebrospinal fluid is tested, you can't see any bacteria or fungus. And a lot of times looking for meningitis, physicians will order a spinal tap, and the spinal fluid can actually be quite purulent, right? There's pus in it, there's bacteria in it, there's white blood cells, and so instead of looking nice and clear, it's cloudy. But with aseptic meningitis, you don't see that. You still see it being nice and clear. And generally, it's going to be caused by enteroviruses. These are going to be viruses that affect the GI system, but somehow are able to gain access to the central nervous system. And other viruses can play a role as well. So which one would you rather have? Bacterial, fungal, or viral meningitis? All right, that's the question of the day. And in all scenarios, I think you should choose viruses. Why? You can't treat viruses with anything. You just have to let it run its own course. But with viruses, all right, the symptoms are not nearly as severe. It may take you a week or two to fully recover from the disease, but there's very few times where a person actually dies because of the infection. Whereas bacterial pneumonia or bacterial meningitis, even though you can treat it because it is, you can treat bacteria with antibiotics, it can kill you in 12 hours. So definitely viral meningitis is what you would like to have. And that just is same information I was just talking about, that viral meningitis is generally milder. And then here are just some tables to look at. And then this is a table looking at neonatal meningitis. And the one thing that I want you to look at is just Streptococcus agalactiae. Streptococcus agalactiae is an organism that can be the normal flora in the vagina, and so this can be contracted by infants as they're passing through the birth canal.